Welcome to the Health and Healing from the Inside Out podcast with Stephanie A. Wynn, an online health and wellness podcast where I, your host, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. The Health and Healing from the Inside Out podcast is a mixture of special guest interviews from healthcare professionals, IBD survivors, Crohn's survivors, ulcerative colitis survivors, and community thought leaders. Be sure to select the subscribe button and let's start the health and healing process from the inside out. We are back for another episode of the Health and Healing from the Inside Out. I am your host, Stephanie A. Wynn, and this week's topic, we're talking about what is inflammatory bowel disease, also known as IBD. So I am super excited about this week's episode, but before we get into this week's topic, I will like to talk about 3 things that you're going to need before you start the healing process. The healing process will require from you 2 things, and that is changing your mindset and truly getting an understanding about your health. Like when I say change your mindset, you have to have a growth mindset in order to bring about effective change to your health, to the healing process. And it starts from the inside, right? So once you start the process and start the healing process from the inside, it's all going to show on the outside, right? So remember, before we start anything, it's going to start with your mindset. Your mindset is so vital to healing. I'm telling you, I know, I've been there. Trust and believe me. If you don't believe that you can be healed and you don't believe that you can be healthy, then you're not going to be healthy. This is for my inflammatory bowel disease survivors out here who may have been recently diagnosed with IBD or you've been living with this for a while. You got to change your mindset. You got to change your mindset and you really got to get an understanding about your health. What is IBD? Understand what it is, what the symptoms are, how you can, feel better. Don't you want to feel better? I know I did. That's all I want. I just wanted to feel better. That's all I wanted to do. So for those, if I'm new to your timeline, I wanted to introduce myself. I'm Stephanie A. Wynn. I'm an IBD survivor. I'm not a licensed healthcare provider. However, I am a recipient of this horrific condition. I was diagnosed with inflammatory bowel disease about 4 years ago. And my goal is to truly bring about effective change to the IBD community, to get the resources and the tools and just the knowledge about this condition. IBD is not talked about like breast cancer awareness or even American Heart Association. So many people don't even know what Crohn's disease or ulcerative colitis is. We see the commercials, but nobody really knows what it is when you're talking about it, right? So my goal is to educate the community so that they can know exactly what it is and how it affects us, right? So what is IBD? What is inflammatory bowel disease? So what I'm going to tell you is IBD is a mother like no other. It is a mother and it does not discriminate. There are no holds barred with this disease. In fact, inflammatory bowel disease, if we want to get on a spiritual level, it comes to kill, steal, and destroy you if you let it. If you let it. But let me give you the actual definition of what inflammatory bowel disease is, right? So, inflammatory bowel disease is a serious condition affecting the digestive system. It occurs when the gastrointestinal tract becomes inflamed over a period of time. So IBD is something, my friends, just doesn't appear overnight like a headache, then go away, then it comes back the next day. It's not like a migraine, right? It's not like a headache. Inflammatory bowel disease, it takes a while for the symptoms to start showing up, especially if you don't get tested for it, right? It also causes inflammation that can lead to significant symptoms such as abdominal pain, bloody stools, and diarrhea. In severe cases, it can even result in life-threatening complications like fistulas and abscesses, right? It can also lead to, if not detected in time, it can also lead to either rectum cancer, colon cancer, and anal cancer. You got to get understanding about your health when you're diagnosed with inflammatory bowel disease. Some of us are suffering with this. We're suffering in silence because I did. I did it for years. And sometimes it become the norm for, seeing the blood in your stools or being constipated, or some people just think that that's normal, and it's not. It's not normal. So let's talk about this, right? IBD is also like the umbrella for two chronic illnesses, right? The first chronic illness, let's talk about this, is Crohn's disease. When I was telling people, hey, I'm diagnosed with Crohn's disease and ulcerative colitis, they was like, well, what's that? What is that? Nobody really knows about it because they really don't talk about it. So let's talk about what Crohn's disease is. It's an inflammatory bowel disease that causes swelling and sores deep in the layers of tissues along your digestive tract, from your mouth to your anus. It is a chronic inflammatory disease that affects the gastrointestinal tract. Crohn's disease is not by any means a trendy disease or well known in the community. It's not as popular as breast cancer, like I stated before, or heart disease. One thing for sure I will say, it definitely affects individuals differently. It is debilitating, and it will wreak havoc on a person's life just as much, if not more so, than ulcerative colitis. Here are some of the frequent symptoms that some people may have with dealing with Crohn's disease. Very frequent diarrhea, so you may have the urgency to go to the bathroom a lot. Severe urgency to eliminate. Maybe you got to take off to the bathroom, but you go and there's nothing there. Severe abdominal and rectal pain, blood in your stools, fever, rapid weight loss, loss of appetite, acid reflux, and tooth erosion. So I want to elaborate on this last one that I talked about, tooth erosion, because this is something very important for those that are listening to this podcast episode. It is so vital when you're recently diagnosed with inflammatory bowel disease. You really need to seek a dentist. Find you a dentist that has compassion and passion for your health, because the acid alone from, the acid reflux and the vomiting and the nausea, it will erode your gums. I'm big on oral hygiene, and I've always kept up with my teeth. I love my smile, and it's important to me, right? And so that's one of the things that I suffered with when I was diagnosed, was the acid from, just the inflammation, and even having inflammation, how my gums became inflamed. So this thing, when I tell you it is a mother, it is a mother. So I want you to say this. IBD is a mother. Treatment for Crohn's disease varies depending on the severity of each individual case. So it can also reduce signs and symptoms and induce and maintain remission in adult patients with moderately to severe active Crohn's disease. Some people don't respond well to other therapies. So as I was going through many tests for Crohn's and ulcerative colitis, I was put on numerous medications such as anti-inflammatories, corticosteroids, and antibiotics and immunomodulators. They suppress your immune system. So that's Crohn's disease in a whole, right? So let's get to the next one. We're going to talk about what is ulcerative colitis. Ulcerative colitis is another form of inflammatory bowel disease. In ulcerative colitis, it affects the entire large bowel, so the colon and the rectum. The inflammation is confined to the innermost layer of the intestinal wall, the mucosa, and UC can go into remission and reoccur. The most common symptoms for ulcerative colitis includes abdominal cramping, pain, diarrhea, bleeding with bowel movements, fever, fatigue, weight loss. It also can go into remission. Maybe your healthcare team has found a drug that can help suppress your immune system and help you with getting on the right track. Let me tell you something. I was in a really bad place. When I found my healthcare team, my mom was literally having to hold me up, and I got down from a 14 to a size 0. I mean, I was skinny like olive oil from Popeye. And I'm going to say that. It's the truth. I was so small. It was sad, y'all. Like it literally was sad. And I don't want no one else to have to suffer in silence with this inflammatory bowel disease. This disease, if you do not get treated, it will come to kill, steal, and destroy your life. It took me off of a stressful job. I was so ill, I didn't care about being laid off of that job because I knew I needed to get my health under control. I couldn't even hold the phone up. When they said, "Oh, we can't extend any more time to you because of your illness." Listen, I'm here to say this. At that point in my life, all I cared about was getting better. All my goal is that I will live and I will not die. So it depends on whoever is listening to this episode and you really want to heal, you got to know your numbers. Get you a healthcare team that's going to believe in you and they are going to have compassion for you. I know there are some doctors out here that don't have good bedside manners. And I'm just here to say this. My goal is to help IBD patients. I want to bridge the gap between the patients and the providers so that we can really get an understanding of our health, specifically in the African American community. It's not that we can't get the resources that we need. We just don't understand where to go. We don't understand the language. But for those that don't understand the language, I'm here to help you understand the language, if you understand what I'm saying. So again, inflammatory bowel disease will take you out if you let it. One of the good things about our episodes is that I want to leave you all with affirmations because you're going to need those on this journey. You can't go through this by yourself. You're going to need mental wellness. You're going to need mental health counselors. I'm telling you, therapy, that's what saved me. Because my mom and dad, they couldn't help me mentally. Parents want to step in and they want to just take it all away from you, but they can't. And to see my parents look at me and look at the fear in their eyes when I couldn't get out the bed. Listen, y'all, I stopped driving like I was a full-fledged butterfly out here. I mean, I had plans. My sons were adults. I had plans to travel the world. I mean, I was going to sail the French Riviera. I mean, come on, y'all. And this. And the mother came, inflammatory bowel disease. She came to kill, steal, and destroy Stephanie A. Wynn. But let me tell you something. I lost a lot of so-called friends along the way. A lot of friends that I thought were for me that wasn't. They're no longer there. By the time I looked up, they were gone. And I was okay with that. And sometimes when you're going through adversity, when you're going through a diagnosis such as inflammatory bowel disease, it doesn't even matter that they're no longer in your space. We're going to get to these affirmations. And I thank you so much for tuning in to this week's episode. So this week's affirmations, I want you to tell yourself, my mind is strong. I am healed, right? I am amazing. I will live and not die. I am healthy. So in order to heal, in order to get healthy, it starts with your mindset. So I'm going to leave you with this quote for this week, right? Great things never came from comfort zones. What does that mean? See, when you're sick and you've been diagnosed with something, you get real uncomfortable. I mean, really uncomfortable. Now you're uncomfortable because it's something that you're not aware of. You don't know about this thing. I didn't know anything about inflammatory bowel disease. So I had to get educated. So I'm going to go back to those two things that getting your mindset right is going to require two things. The process, that means you got to get understanding about your health, the terminology, the language. What is IBD? What is Crohn's disease? What is ulcerative colitis? What is proctitis? All of these are forms of this mother. You got to learn this. You got to learn this and not just learn it, but apply the knowledge that you're learning. I want to thank you all for tuning into this week's episode. I'm your host, Stephanie A. Wynn. Until next time, peace. Thank you so much for tuning in to the Health and Healing from the Inside Out podcast, an online health and wellness podcast where I, your host, Stephanie A. Wynn, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. Be sure to select the subscribe button and let's start the health and healing process from the inside out.